Sorry, guys. Y'all know how I am about time. I apologize. I'm so glad to see so many of you already on here. Don't worry, we are going to do this presentation. I've been having a Monday every single day of this week with this doggone computer. It has tried its hardest to cut me down every chance it got. So I am logging in to show the presentation, and you should be able to see it in just a moment. We have a good group today. I hope y'all have brought lots of questions. So as we are loading the presentation now, you should be able to see my host presentation in just a few moments. If you do not have your pencil and your paper or your phone or digital, whatever that you wrote all your questions on, you have a moment to go and grab that because this is obviously live. And so I'll be entertaining lots of questions today, hopefully answering lots of questions too that you didn't know that you had. And so um, we will we'll be hosting that. Oh, I'm getting a message from my host right now. Okay, cool. The screen sharing should be starting momentarily. All right, let me know if you're able to see the practice in pregnancy orientation with yours truly. Raise your hand. All right, I see the thumbs going up. So we can go ahead and get started. I'm not going to hold you very long. All right, a couple of housekeeping items first. This is confidential, so I will get a list of who attended the webinar later on, but no one will be able to see that list except for me. So no one will know that it's you asking this question. There are no silly questions. So please feel free to go ahead and ask whatever you need to in real time. Please participate. I have some poll questions. Hopefully we'll be able to get those up. If not, just, I'll ask some questions and somebody will toss me an answer. And then if you have to hop off, I know dinner time's coming up, but this will be available on our YouTube channel for the next 6 months. The idea is to have the most current information for your pregnancy. And so it will be out there available. So we are going to start out with a poll question right now, hopefully. Want to know who's on the line, how many first-time mamas do I have, and how many veteran moms do I have? So hopefully you're able to see that poll too. And if so, go ahead and answer it. Answering the polls also helps me to direct what my next sentences will be. And so I'll just know that we have more mommy veterans this time. So don't worry, first time moms, I'm still going to give you everything you need. All right, then I'll say polls are closed. The polls will be closed. You'll see the results and we will move on. So for the first time in a while, the mommy veterans outnumber the first time moms. All right, so things we're going to go over today. We're going to go through the full circle experience, which includes where we deliver. We'll go through some office protocols. We will also talk about what to expect at each of your visits. We'll go through I'll give you lots of prenatal resources, actually. We'll talk about exercise and nutrition in pregnancy. And then we're going to wrap up with a quick COVID-19 update before we close out. So first thing I want to just talk about the full circle philosophy is the collaborative midwifery model. And this operates under the guise that pregnancy and birth are normal life processes. This is not some disease that you contracted, and now we all have to be worried about whether we're going to be able to cure you. This is a physiologic process. This is something normal and natural and what your body is supposed to do. And so our goal is to let your body do it and only step in if things turn left. So some of you I know came in as my GYN patients, Dr. Merrill, Dr. Mooney's GYN patients, and you're looking to come in and have physician care for your pregnancies. So we're based on the traditional midwifery model where midwives actually care for pregnant women. But in the traditional model, women are normal, they're low risk. If there's any abnormality that they notice, then it's transferred out to have access to a physician. In the collaborative model, you stay under the care of the midwife with physician direction. So you won't directly be cared for by the physicians. You will indirectly be cared for because we meet every 2 weeks, discuss everybody who's pregnant. Everyone who comes through here does an OB history with me where I assess your risk factors and make a plan for your pregnancy. And obviously, if there's something that requires physician input, it's going to come from the physicians, but you will not see my face all the time. I'm so sorry. And most of the labors and deliveries are attended by our certified nurse midwives because they are the experts in care for the normal laboring mom with physiologic labor going on and care of the normal newborn. Now, there are times that things arise that are outside the scope of midwifery care. And in those instances, physician consults, they know how to call us. If it's something urgent, meaning it's something that cannot wait until the morning, the full circle physicians, myself, Dr. Mira, Dr. Mooney, are always on call backing up our midwives. If it is something emergent, meaning you do not have the 15 minutes it may take one of us to get into the hospital, there are OB hospitalists, board certified OBGYNs who are in-house 24 hours a day for true emergencies. And this stat is a couple of years old, but it's pretty standard across the board. For example, when we did over 540 deliveries in 2022, only two of those times did we actually need to call the hospitalist. And I'll tell you, the most common reasons we call the hospitalist are when people come in and they're 10 centimeters and nobody actually gets there. So it's not even the midwife, it's the OB hospitalist doing the delivery. So please give us enough time to get there for your delivery. Where is there? Great question. Where do we deliver? At HCA Florida, which is very close to our facility, less than 10 minutes from Full Circle. They are doing tours. There actually is a stork tour coming up. I believe it's May 22nd. But when you come in for your visit, the information is on laminated things on the wall. Everybody on this call, I believe, has plenty of time to catch a stork tour. It's like a little baby shower. They have snacks and they do tours of the facility. But if those times don't work for you, they do one-on-one tours. And so if you're here in the office and you need the phone number for that, you can call. They do them anytime, like during the day, in the evening. They do them on the weekends. They want to be able to accommodate you and whatever family members you want to come and see where you're going to be meeting your little one or little ones. All right. We are open Monday through Thursday from 9 a.m. to 1 p.m. Then we close for lunch from 1 to 2. And we reopen at 2 p.m. and we're open until 5. On Friday, we close at 1 p.m. So if you are calling between 1 and 2, Monday through Thursday, you will get what sounds like the after hours line. The phones are not broken. The reason we use the after hours line during that time is if there is a medical emergency during that time, the after hours rings to the provider who is on call. You have to leave a voicemail for her to call you back. But if it is not an emergency, please don't leave a message on that line because it will not get back to the front office because that is also the person who's in the hospital taking care of emergencies. If it's something administrative, say you call on a Friday at 12:54 p.m., just know that request or inquiry may be responded to when we open back up on Monday at 9 or Tuesday if it's a holiday. For appointments, our goal at Full Circle is to see you as close to your appointment time as possible. Today I said, y'all know how I am about time. I was sitting here itching. Um, so to that end, we don't have walk-in appointments because I promise you, the time that you are promised an appointment, somebody else is out there hoping to walk in with a problem at that same time. And if I promised you that time, I can't see you at that time if I'm dealing with someone who just happened to walk in 30 seconds before you, and that's not fair to you. To that end, we do have limited same-day appointments. So sometimes you'll call in the morning with a problem and we'll say, hey, Lauren has a 2:20. Let's bring you in for that. If you're not able to wait until 2:20, though, we may say, you know what, you're right. This sounds kind of urgent. You need to go to an urgent care or go to the hospital to be evaluated. It's not us saying that we refuse to see you in the office. It's us saying that we agree that you need to be seen, but we don't have an open space for it that we haven't promised to anyone else. And we do the exact same thing when it's your appointment time. We show everybody the same amount of respect. And urgent matters sometimes require an urgent care setting. All right. So when you are calling for an issue, remember providers can't leave patient appointments to take phone calls because again, we promise you that time I'm going to be in your visit talking to you and not taking phone calls from someone else. We do have a nurse who takes calls and she's able to triage what the common pregnancy complaints are. But if there's anything outside the scope of what she's used to dealing with, she knows how to get in touch with the on-call provider during the day. You do have to leave a message with the right person in order to receive a call back about the right thing. And so the right person for the right things on the next slide. So you're going to leave a message with Tony. who is our nurse. She also does pregnancy administrative stuff, like if you have FMLA paperwork or disability paperwork. We also have a clinical coordinator. Those of you who have already had your OB history visit may have already heard from her because she sends out labs, she sends referrals. If you need something scheduled, like a version, a delivery, induction, whatever, Naisha's that person, your baby circumcision. And then if you have something about insurance, I believe everyone here has also spoken with Renee Hall, our benefits coordinator. So if for some reason during this pregnancy your insurance changes, or you meet your deductible or out of pocket or whatever, please let us know because we don't want to be collecting on an old payment plan that no longer applies to what your current insurance situation is. All right. After hours, there's always someone from our practice on call for our practice. And this is for if you think you need to go to the hospital. So this isn't prescription refills. This isn't what did Dawn say in my appointment 2 weeks ago? So, and remember, you have to leave a voicemail message to receive a call back because the phone doesn't even register that a call came through unless a voicemail is left. You just call the same number that you would for the regular office during business hours and follow the prompts to get to the after hours on call provider. All right. The patient portal is also a way to non-emergently contact us, non-emergently, because response times can take up to 2 business days. So if you send a message on Thursday, your response may come through on Monday because Friday, not Saturday, Sunday, Monday is the next business day. So if this is something that should not wait from Thursday to Monday, please do not put it in the patient portal. The portal is, hold on, the next slide, I'm sorry. If it's a non-action item, we can definitely answer it at your next upcoming appointment. Things like, is it okay to take this supplement? I have a trip coming up in 4 weeks and I want to know if I can do this. Those are things that we're going to see you before that. So we're happy to talk to you about those things in person. And then, so think of the portal as things like, oh, they gave me a lab slip last time, but I lost it, and I really need to get these labs done before my next visit. Definitely send us a message. We can email you a new slip. Or I have COVID and I need to cancel my upcoming appointment. Let us know there because as long as it's not 2 business days away, we'll be able to convert you to a virtual appointment or something along those lines so we can still accommodate you. So again, nothing urgent in the portal, please. Do not send me messages saying, my blood pressure is 180 over 120, Dr. A. What should I do? You should get off of this portal and go to the hospital. If you don't feel your baby moving, if you're having heavy bleeding, those are not portal messages. Please don't send blitz messages too. So if you send a message and you don't get a response back in 2, 4, 6, 8 hours, please don't then send that message to the next person and the next person and the next person and the next person. There's multiple messages to one provider and or different providers. Remember, portal messages are what we do in our off time when we're supposed to be hanging with our families. We don't mind doing a couple of things to make your life a little easier, but then sometimes y'all get upset because you've talked to 5 people and 5 people have sent you prescriptions for your UTI and now you're mad because your pharmacy is saying you're abusing antibiotics. So just talk to one person. If that person doesn't respond in 2 business days, then you can send to somebody else. Also, please don't attempt to have a whole appointment over the portal. Text yourself questions or schedule an appointment. We typically make phone calls about things like abnormal genetic screening or cancer diagnosis or that sort of thing. But if you need to have a discussion about something, then an appointment is the ideal way to bring that up and have a conversation with one of us. The patient portal is also where we release ultrasound results unless there is something urgently abnormal. We will not let you leave the building, not let you leave the building. If there is something urgently abnormal on your ultrasound, we will discuss that on the same day. That's the one exception. We'll break the rule and somebody will be late in their visit to break and come and talk to you. But otherwise, the sonographer prepares her report, downloads it from the machine, uploads it into our electronic medical record system where it's then split up amongst all of us, and then we send it out to you. So give us 2 business days to review it and receive it, review it, respond, and release the result to you. Sometimes you'll see the sonographers typing away and you just want to know what's on my ultrasound report. If you send a portal message, the answer is going to be, we don't know yet because we don't have it because it's like it's done in an outside facility. We have to generate a report. So just give us a chance. Now, if you know that your anxiety is not going to let you wait 2 business days to know what's on that report, be sure you schedule a visit with one of the providers after your ultrasound on the same day. So that's patient portals. You know who else has a patient portal? Quest. And they're very annoying with theirs though, because they'll send the results to you and not to me. And then you get the results and you see all this red and it freaks you out. But let me just tell you now, red doesn't necessarily mean abnormal. The reference ranges that they're using to say what's normal are for non-pregnant people. In pregnancy, the reference ranges are different. So give us a chance to receive the labs from Quest, review them, and release them to you. Now, if you've been sitting on these labs for a week and you haven't heard anything from us, then please let us know because on occasion, Quest forgets to just send it to us at all, and we have to reach out to them and get it from them. Don't send the results to us through your portal. Let us get them from Quest so that it can go into the interface saying that the labs that we ordered were complete and close that loop. All right, next. Sorry. Okay, the next slide, I think we have, you guys are already seeing it. Okay. Um, any questions? All right, so those are all questions on. All right, that was all information on how to contact us. All right, next we're going to get into what to expect at your prenatal visits. So what I always say is the first thing to expect is that you are going to forget all of your questions because pregnancy brain is real. Pregnancy amnesia is not a myth. So start a text thread with yourself. I get so excited when y'all come in and I see y'all pull out your phone and pull out your text threads. Text yourself questions that you want to ask at your visit because you're going to hear the baby's heartbeat every time and then you're going to forget everything else that you needed to say to us. Wear loose, comfortable clothing so that we can get to your belly because we are going to listen to the baby every single time, not ultrasound, but Doppler. Take a listen. We want you to get here about 5 minutes before the scheduled appointment time so you'll have time to check in, handle any business at the front desk, and leave a urine sample if needed. We're not routinely collecting urine on everyone anymore. ACOG says we don't have to do that now. So we'll only need urine if we're following you for high blood pressures to look for protein or high blood sugars to look for glucose, or if you recently had a urinary tract infection and we need a test of cure. You will know, front desk will know if we need a urine sample. So if nobody tells you to do it, we know you're pregnant, you've been drinking water the whole way here, you better be drinking water the whole way here, and you need to go to the bathroom. So run in and go to the bathroom so that you can still get to your room for your appointment on time. All right. We will still see you if you are 10 minutes late. We'll still have time to check on you and your baby, but obviously that leaves a little less time for your text thread. But if you're 20 minutes late, you've missed the whole appointment slot. We're so sorry. Because the next person after you, our goal is to see her at her appointment time as well. And so if someone does have an open spot later in the day, we'll try to work you in. Front desk is really good about it. Just knowing, hey, actually, she's going to miss Dawn. Let me put her in over here with Missy. So when you come in, sometimes they're already ready to offer you another spot. If that doesn't work for you, don't sweat it. We can always just reschedule for another day that works better for everybody involved. And we know sometimes there's traffic stuff, and if everybody is running 10 minutes late, then we're not canceling everybody. So if there's traffic and everybody is behind, then we make exceptions. Diagnostic ultrasound visits. So the other question I always get is, well, if you're not doing an ultrasound at every visit, when are you going to do them? Great question. So diagnostic ultrasound appointments are separate from your prenatal visits. The way to know whether you have one scheduled coming up is to look in your portal and see, do you have more than one appointment time? And is there a provider's name associated with your visit? So my test patient, Tina Test, logs into her portal and she clicks the appointment button and she notes that she has two appointment times on the same day. Her first appointment is at 9:20 with ultrasound, which is not a provider's name. Her second appointment is at 10 a.m. with Dr. Yeckel, which is a provider's name. So Tina has two appointments. The first one is an ultrasound, so she can tell her family, come see the baby. And then after that, if they want to hang around and talk to Dr. Yeckel about the preliminary results on the ultrasound, they can definitely do that. And then she'll get the full report in her portal about 2 business days later, unless there's something urgently abnormal. And Dr. Yeckel would talk to her about that on that day. So that's all the things that are on this slide as well. So please let the front desk know when you need a prenatal visit and a diagnostic ultrasound. Typically, your provider will say to you, hey, you need an ultrasound to follow up this particular issue. And so when you go up to the front desk, they should be giving you two separate appointment times, one for ultrasound and one for regular prenatal visit. All right. If you want to look at your baby more than we need to look at your baby, boutique ultrasounds are a thing. So these are places around town that will do ultrasounds just because it's Tuesday, just because you want to see your baby. These are for informational purposes. We're not endorsing any one over the other, but I just tried to get a few around different areas of the city. And I know there's one in St. Augustine too that I haven't put on here as well. But any of them, they do cute little things. You can bring your family and put the baby's heartbeat in a stuffed animal. It's just really sweet. So remember that these exist. And for those who are wondering when they can find out if it's a boy or girl, if you don't do genetic testing early on that tells you, a lot of these places do sneak peek stuff at 14 to 15 weeks. So our next poll question is just to see if you're paying attention. Um, so how often are you expecting to have ultrasounds? Do let me know. All right, so we are answering the poll, and the answer, we're going to shut the poll off right now. And the answer is at 20, 40, and 41 plus weeks. So the key word here is routine ultrasounds. So routinely, we do our anatomy ultrasound right around 20 weeks. And then we do then if you go past your due date, then we do look again for post dates to make sure that it's safe to stay pregnant. Now, that's routine. If on the 20-week ultrasound there's something that we're really not able to see very well, then we'll look again, but that's not a routine finding there. So if my host would like for me to share my screen, I'm happy to do that. And let me know if you are able to see. Go ahead and raise your hands so I can see if you're able to see the Full Circle Jacks website. Okay, awesome. All right, so fullcirclejacks.com. For those of you who delivered with us before October of last year, you delivered with us at Ascension, and we are at a different facility. You heard me say HCA, and it has been an amazing move. And so, if you missed the town hall that I held in October to go over why we moved, you can click here to watch that. So we're going to start with the providers. And one of these lovely ladies will have the distinct pleasure of helping you welcome your little one or little ones into the world. So there's me with more hair. There's Dr. Marrow with the same amount of hair, probably. Dr. Yeckel. And we have Dr. Mooney here, and then the midwives. There's midwife Lauren, midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. And every single person on this page has the same philosophy. We're on the same page. Again, like I said, we talk all the time. So if you've heard something that you're not sure about from one person and you ask the next person, you're going to hear the exact same thing because we all communicate to make sure that you are getting one unified message. So the next information we're going to be looking at is over here under patient information. You'll see the obstetrics tab. And when you click on there, you will know you're in the right place because you will see all the bellies growing up into the baby here at the end. So lots of good info out here. Our delivery stats, we're very proud of our statistics, and many of you are here because of our statistics. So we have them back to, I think, 2018 here. How many first-time moms end up with a C-section? How many people who come in laboring expecting to deliver end up going to C-section? What's our VBAC success rate? We are not shy about our slides. We're very transparent. And some years are better than others, but we always do our best. Over here, we have the prenatal care timeline. So I'm going to click on this one and just go through what to expect at each visit. So you will see, and hopefully you're able to see this. So first visit, everyone on here has had their pregnancy confirmation visit between 8 and 10 weeks is usually when we like to do that. And after that visit, you're meeting with one of the midwives to go over, are you nauseous, and kind of give you some of the idea of what's coming up. Then you have a virtual visit with me coming up, usually in about a week or two after that. At that visit, I'm going to go over your medical history and order your regular prenatal labs. So again, we have some transparency about how we do blood work here. There are sometimes I've met people and say, hey, well, what labs did you already do? And they say, I don't know, they just kept taking blood. So you will always know what blood we want when because it's all out here. So your standard prenatal labs include your blood type and some blood counts and a urine culture. Your dating ultrasound we talked about, so we're setting your due date around that time. And your goal after you talk to me is to try to get that blood work done as soon as you can. Some of you have opted in for the genetic testing to see whether there's a risk for Down syndrome or other genetic illnesses with your baby, and some have opted out. But we talk about those as at the history visit as well. At this point in pregnancy, we're seeing you every 4 weeks. So about 4 weeks after your dating ultrasound, you're back in the office for your next in-person visit. That's your physical exam. If you're due for a PAP, you're welcome to have your PAP done then. But if you would like to forego it because it's not really part of the panel, some people just say, well, I'm probably not going to be back for a while. And while you're down there, do it. Really, all we need as part of it is the cervical cultures. And so we do that as part of the physical exam, but it's heart, lungs, breast exam, pelvic exam, cervical cultures. For those who talk to me and their history, and we realize you need to see the high risk doctors, this usually is when the high risk doctors see you first, is right around 12 to 13 weeks. So typically, I send the referral when I see you at your history visit, and then you'll see them around 12 to 14 weeks. We do have a question here that I have asked. Okay, the question is, do we allow alternative blood sugar testing, like a continuous blood sugar monitor? That's not one of the options, but there are other options, and I will go through those actually in just a little bit. So after that visit, about 4 weeks later, you come back and we do just a routine second trimester visit. This is when you probably will start feeling the baby move a little bit, so that's kind of exciting. And then around 20 to 22 weeks, as I mentioned, is when we do your anatomy ultrasound. You'll also see on here a mental health screen. And so that is for everyone across the board because pregnancy comes with emotional ups and downs, and so does life. And we want to make sure that we are treating the whole person and identifying people who are at risk for postpartum anxiety, postpartum depression early on. So about 4 weeks later, we'll see the glucose test, which I know I have questions about that, and we're going to put a pin in it, and I will promise I'll come back to it. My moms who have a negative blood type will work on getting ROGAM for you, and that's usually administered right around 20 to 30, excuse me, 28 to 30 weeks. This is when we're going to give you the information to pre-register at the hospital, and everything is online at HCA. You're going to schedule your hospital tour or, of course, do the store tours. And if you're planning on working with a doula, we'll talk about doulas in a little bit. This is when you want to have her locked in. After this visit is when we start seeing you every 2 weeks. So my first time moms, you want to start looking for your pediatrician. My veteran moms decide if you're staying with the same pediatrician. And then if you have not gotten your Tdap or your third trimester flu vaccine, then these are also the times to do those. We don't do those here in the office, but you'll want to see your primary care doctor or urgent care to get those done. You'll see here in the middle the option to repeat or decline the standard prenatal labs. So we discussed that you get those done in your first trimester, and those are the ACOG recommendations. The repeat is more Duval County Health Department, and that obviously may be tailored to different high risk populations. So if you feel you are not a high risk member of the high risk population, we do have standard opt out forms for that. Around 32 weeks, if you have some pregnancy complications, is when we may start additional testing for you. For my moms who are anticipating having a belly birth, we begin to select your date around 33 weeks so we can try to get that finalized in a couple of weeks so you can start planning. And the belly birth, by the way, is our name for a C-section. And then 36 weeks is when we do another pelvic exam, and that's for group beta strep, which is something that we'll discuss at that time, tell you why it's important. If you've already opted out of repeating the standard prenatal labs, you're also opting out of repeating the cervical screening, and you don't have to sign another form for that. But after the 36-week appointment, we start seeing you weekly. It gets real. You can bring in that birth plan for discussion. We start your natural cervical ripening methods, which I'll go over in a little bit. For my moms doing the belly birth, you get off the train before 39 weeks. At the 40-week mark, we start your post-dates testing, and be patient because baby gets to pick his or her due date up to the 42nd week. So we want everybody out by 42 weeks. So first-time mamas, we typically like to start your labor induction if necessary at 41 weeks and 5 days. That gives us more time to go slowly and, and methodically, so we're not pushing the body into something it's not ready to do. And second time moms, 41 weeks and 6 days, because again, your labors are usually a lot shorter. First time mamas, your average length of labor is going to be about 24 hours. We do a terrible job of telling you what to expect with that, but that is the average. So sometimes it is 12, sometimes it's 36, but the average is 24. So normally I have a poll question right here about medications, but I think I took over this from the host, and so I'm just going to move straight into pregnancy medications because, oh, and look at my host. If you have a headache during pregnancy, are you more likely to meditate, medicate, or evacuate your house and go to the emergency room because it's a terrible headache? Certainly hope that's not the case. I'm going to look at this question here. Question is, how often do you need a Tdap shot? So CDC recommends having it with each pregnancy. And also, but if you haven't had one in the last 10 years, you definitely want to get that booster. All right, and polls are closed. We have more meditators than medicators and one evacuator. Oh my goodness. All right, well, hopefully you will not need to go to the emergency room for a headache. Hopefully you'll try something first, and then you won't need to go take that $500 Tylenol at the emergency room. All right, so going back over here under safe medications in pregnancy, I have a list of common pregnancy discomforts and symptoms in alphabetical order here on the left. And then you'll see some relief measures here in the middle. So if you send me a portal message saying, hey, Dr. Adams, I'm so constipated, what do I do? First thing I'm going to ask is, have you tried everything on the list and our safe medications? And so if you've exhausted everything on the relief measures and the third column over here where we have some medicines that we can try, then definitely reach out to one of us. But I promise this will be the first thing any one of us is going to say. Have you tried everything on the list? So there are a lot of good things on here, including some things we don't recommend during pregnancy. You can see it kind of goes on to the second page too. So if you have a cough or cold, that sort of thing, sore throat, all of these different things. Just remember that this is out here, including this really important caveat. If you can't keep food down for 24 hours, please give us a call because you may need to go in for some IV hydration. I do have another. How soon can you find out the gender from genetic testing? And the question, typically the results come back in 12 to 14 days. And the question on here is, how do I feel about melatonin? And it is right here on the list. So that is how I feel about it. It's on the list, so it's good. All right. Next, we will go to gestational diabetes screening. So we're not going to click on this box, but please remember that this box exists. Actually, I will click on it real quick just to show you that it's a document, it's a form that you're able to look at. You will not need this until 24-ish to 26 weeks, but just remember that this is out here. So we'll talk about this in just a moment. Weight gain in pregnancy is a question that I've gotten a lot because people are concerned that they have either gained too much or too little weight. So first thing I want to point out is your rates of weight gain are in the second and third trimester. So I can't judge you if you're still in your first trimester because we're expecting people to gain the majority of their weight at this time. And this is really how your body is going to function. You put on most of your blood volume, your placenta, and your fluid gain, and then your baby gets really chunky in that third trimester. So there's a link on here you can click in, put in your height and weight, and that will take you someplace to tell you where your pre-pregnancy body mass index is, and based on that, it tells you how much weight you should be gaining in pregnancy. And the rates of weight gain, as I said, per week, you can see over here. So as we go back to the presentation, I'm going to answer a couple of these questions out here. How do you feel about supplements like collagen peptides and hydrolyzed whey protein? That's something you'll want to bring in what specific supplement you're taking to your visit. Let your midwife take a look at it and see if that is something okay, because there are hundreds of them and some of them have other additives that we don't recommend. So bring in your specific brand to your appointment. The next question is, can the baby gender be hidden to parents after the genetic test? You sound like someone who has not had a history visit with me because we actually go over this in the history visit. So if you can, the short answer is we don't put it in an envelope. We put it on your portal, but it comes in a message that says do not open. So if you forget that I said that, don't worry. Your history visit is coming up. I'll tell you again when we have that visit together. Next question is, I'm hungry during my first trimester. Good for you. A lot of people are not. Eating healthy and enough protein and fiber, could this just be normal? Yes, it's normal to be hungry. That's okay. Why do you not allow women to go to 42 plus weeks? Because of the risk of stillbirth goes up over 2% after 42 weeks. And 1 in 50 babies being stillborn is too high of a risk. At the beginning, you mentioned we'd be transferred to a doctor if identified as high risk. No, I didn't. What I said was if you need a consultation with the high risk doctors, then you have a consultation, but you'll still be staying with us as your primary doctors. And the question is, should I be concerned if I've lost a few pounds in my first trimester? You should not, because your rates of weight gain are measured in your second and your third trimester. The next question is, do you do a chromosome test to find out sex? We don't do one to find out sex. We do one to find out about Down syndrome, trisomy 13 or 18, but because it does look at the sex chromosomes as well, you can additionally find out baby sex. If you only want to know the baby sex, though, there's a separate test that you can do, and I will talk about that at your history visit, because it sounds like you also have not had a history visit with me yet where we talk about genetic testing. Can I take the vitamin B6 daily? Yes, you can. Should I be concerned if I have mild cramps every now and then? Every now and then, no. The uterus is just a muscle, and the muscle is getting bigger, and muscles can cramp. I previously had diastasis with my first pregnancy. Is it normal I have a small belly bulge already at 9 weeks? Yes, second babies definitely show faster than first babies. Man, y'all have lots of questions. Those came out of nowhere. Okay, next, birth preferences. So at some point, you're going to want to make a birth plan. And so this is our template for a birth plan because this addresses most of the things that people are looking for in their birth experience. So everything from how you would like labor to start, to what you want to wear in labor, how you want to be monitored. If you're going for certain types of deliveries like vaginal birth after cesarean, they do require continuous monitoring, but we have wireless monitors. So we can monitor you continuously without impeding your movement. We have pain relief measures here. We do have tubs for labor on the unit, as well as nitrous oxide should be available by the time all of you deliver. So I think the main thing to take home here is that we're not starving you and we're not strapping you to the bed. Like we encourage you and your baby to be active members of this labor. So you can see this carries on to the next page, and you can see some of the standard things that we do are delayed cord clamping, immediate skin to skin, that sort of thing. And you have early latch. The nurses are trained to help you with latch. They also have lactation consultants that round automatically. There's a box here about routine medications that are offered to the newborn. And you always have an opportunity to come in and ask the midwives whether this applies to you. What is this used for? That's what your prenatal visits are for, to kind of dig into this and figure out which things mean the most to you and what boxes you want to check on your particular birth plan. And remember, we'll want to go over those when you're about 36 weeks. And the next question that I have, can I use rosemary water on the scalp in bedtime? Don't believe that's one of the ones that stimulates contractions. You just want to stay away from clary sage. And the next question is, I can't do tub delivery if I'm using epidural. We don't do tub deliveries, we do tub labor, but no, you won't be able to get into the tub if you have an epidural. You can labor in the tub until you're ready to get the epidural, and you can get out and get the epidural. So we can do a combination sort of situation there. And the question is nitrous an option if I have a history of hemorrhage? Yes, it is still. Because with a history of hemorrhage, we're going to be giving you medications to prevent it again anyway, which will counteract the nitrous. And the next question is, can I opt out of antibiotics even if I test positive for the bacteria? We do have against medical advice forms that you can sign if you decide to make a different plan than the one that we recommend. All right, cervical ripening techniques. Opening this up because at some point this pregnancy is going to end and you guys will want to figure out how to get this cervix ripe so we can get this baby out. So there's a lot of good things on here, and you can just see there's evening primrose, there's clary sage, there's membrane sweeping, there's breast pump, raspberry leaf tea. So you can just see week by week the things that we recommend on there. You will also see that what is not recommended on there is castor oil. And be sure to ask your midwife at one of your next prenatal visits why we do not recommend castor oil. All right. We have a poll question. How many moms do I have on here who had a C-section before? and are going for a vaginal birth. I know this will not apply to my first time mamas, but is there anyone on here who's planning a VBAC, vaginal birth after cesarean? 5, 4, 3, 2, 1. Close polls. Sweet, we got a couple VBAC moms on here. Now, this next box that I'm opening up, it says first time moms and trial of labor after cesarean. My first time mamas, listen up. This is for you because you're basically doing the same thing that these VBAC mamas are doing too. You are trying to avoid a C-section. That first C-section is so imperative to avoid. And this is our list of ways to control what you can. Babies are going to baby. They're going to do whatever they're going to do. But if you just know that you've done everything that you can on your part, then you can feel good about the effort that you made toward getting the vaginal delivery you were trying to get. So if you're seeing a chiropractor, make sure they're Webster certified, do some pregnancy yoga, squats, watch your weight gain, hire a good doula, make sure your baby's in good position, all of that good stuff. So you can read line by line which things we want you to do, but every single one of these is very, very important. I say this to you as a VBAC mama. I was one who had a C-section the first time, and I wanted to avoid it the second time. And so I did everything on this list. Dr. Merrow did everything on this list. Midwife Lauren did everything on this list. So you have 3 successful VBAC providers in this practice. And we are here to advocate for you and work with you to try to get the birth that you want. Please meet us halfway. All right, another question here before I get to the last thing. If baby needs medical attention and needs to be transferred to Children's Hospital, will you help get me transferred with baby? I think we should probably talk about that in one of your visits because it's individualized. Obviously, it depends on what's going on with you. And so we should talk about that at one of your personal visits because that sounds like an individualized question. And the next question is, do you have recommended doulas? We're going to talk about doulas in just a moment. All right, last thing on the website is circumcision care. If you have a little guy and you want to get his pencil sharpened, you are going to let us know when you deliver, and we'll send a message to our OB coordinator, and Naisha will send you a portal message within the next couple of days letting you know when his little appointment is. We don't do them at the hospital, but we do them before he turns 10 days of age in the office, and so we'll get you scheduled for that. All right, and so now we're heading into, guess what? Nutrition. That's right. So for those who are concerned that they may be gaining too much in the beginning and not sure why, Dr. Adams, all I'm doing is drinking coffee in the morning. Is it coffee or is it one of these mocha monstrosities with all the calories and all the fat and sugar? Did you know that pregnancy only requires an additional 300 calories per day? That's not a lot. I know some people say, eat for 2. Please don't do that. If you're an American, you're already eating for 3. So please do not eat for 2 Americans. It takes 10 kilocalories to maintain 1 pound of body weight. And the recommended amount of weight gain, remember, is based on your starting body mass index. So let's say you're starting the pregnancy at 170 pounds. It takes 1,700 net calories to maintain that weight. If your goal weight gain is 25 pounds, you get an additional 250 calories for a total daily caloric intake net 1950. Now, if we divide that between breakfast, lunch, and dinner, that's 650 calories per meal, and this is net. Now, if you are working out and burning 500 calories a day, 1, more power to you, girl. But 2, obviously you can take in a few more calories, but you want to make sure that your net is hanging out right around here. So, what things are you okay to eat? So this is a nice slide that just kind of subtly, not so subtly, illustrates that you can make some better choices by making slight adjustments. So if we look at the spaghetti sauce over here, we can cut out a whole bunch of sodium by just picking the different one. Because when y'all send me messages, Dr. A, none of my rings fit anymore. What do I do? The first thing I'm going to ask is say, hey, what'd you eat last night? 9 times out of 10, y'all say Chinese food, but I'm just saying there are other things too that can make you swell. So please be mindful of your sodium intake. When you start turning your food over and looking at how much salt is in stuff, it will be appalling to you. Also, take a look over here on the left. You'll see what things you want to limit. You want to try to get enough of your nutrients and just keep your carbohydrates at a healthy 40% of your total intake. The next question I have is what can I do for gastric problems? I'm bloated by the evening every day. Because of this, it's hard to lay on the bed easily. So that one we do have gas on the pregnancy because that is a common pregnancy discomfort. So that's on the website with the list of things that you can do for gas, like foods to avoid and what medicines you can take as well. So you want to eat fruits, you want to eat veggies, whole grain, and cereal. You're not going to give your baby a sensitivity to nuts or dairy if you take those. So please just enjoy them. For my coffee drinkers, real coffee, not Mocha Monstrosity, you want to maintain less than 200 milligrams daily. And I know the American Pregnancy Association says that that is a limit, but that's a lot of caffeine. That's like 3 or 4 cups of coffee. And remember, coffee is a diuretic as well as a stimulant. So if it's making your heartbeat faster, it can at times give baby an irregular heartbeat toward the end of pregnancy as well. So less is always a little bit better. Herbal teas are fine, and some of our faves are raspberry leaf, ginger, lemon, and peppermint. With the caffeine, though, remember the diuretic piece. You want to use the 3-to-1 rule with your water. So drink 3 times as much water as caffeinated beverage so that you're staying well hydrated, even in the setting of drinking caffeine. For my vegetarians, my vegans, please make sure that you're keeping your protein intake at about 70 grams per day. Please do not follow those diets that tell you to cram in 120 grams of protein daily. You will grow an 11-pound baby. And I mean, maybe you can push it out, but just that's uncomfortable. Your poor pelvic floor. Just don't do that to any of us, please. 70 grams is plenty of protein for you and baby to stay okay. Yes, you can have deli meat. Just be sure you're microwaving it 30 seconds to kill any of the bacteria that may be residual there. Soft cheeses, as long as they're made with pasteurized milk, are okay. So just flip them over if you're buying them from Trader Joe's or what have you, and you can just make sure that it's okay. If you're at a restaurant, you can't verify it's not pasteurized, although most restaurants aren't really taking that risk. Just skip the soft cheese for that night. And canned tuna, you can have 3 of the 4-ounce cans per week. For my pescatarians, if you need more fish than that, here is a very lovely document by the FDA that tells you which fish you should be eating in larger amounts because they are high in DHA and omega-3 acids, which are good for baby's brain development, which ones to eat in moderation because they neither are plus nor minus for you, and which ones you want to avoid or eat sparingly because of things like methylmercury. It's a 2-page document. It's this I just updated on 2021, but I'm sure they have a new updated version out there. This is available on our YouTube later on. So things that you want to avoid are undercooked meats and fish. So if you are a foodie like me and you like your steaks medium or your yummy ahi tuna, this will be a miserable 6 to 7 months of ruined food. All steaks must be well done. I'm sorry. My kombucha drinkers, my kimchi eaters, those are fermented beverage for fermented snacks, and we want to limit, if not eliminate those, because your body can treat them as an alcohol. And so, same thing with alcohol, no more alcohol. And also the sodium, as I mentioned, you want to keep it under 1,500 milligrams of sodium per day. So next question I have is, do we need to take milk every day? If so, what kind of milk do you suggest? Nope, you don't need milk every day. You just want to keep your calcium intake up. You want about 1,500 milligrams of calcium per day by whatever, and broccoli has a lot of calcium in it. And is it common in pregnancy to have gas with a bad smell? Possibly, or maybe that's something we should talk about you at your visit. And the next question is steamed oysters or pass, as long as it is cooked all the way through, then you're fine. And the next question I have is, does HCA Memorial have a NICU? So for those who are with me at Ascension before, this is a lateral move in terms of NICU. It's actually even the same neonatal group that was at Ascension actually rotates through. So you may even see some of the same doctors. But the short answer is yes, they have a NICU, and it is the same level as Ascension. So we did not lose any ground on that move. All right. Sweet. Next question is, I've been drinking kombucha. It's helped with nausea. I'll stop, but I didn't do any damage. It's unlikely that you did any damage. These are things that we don't have an idea of what the actual dose that's not safe is for our recommendations. So we just tell people to avoid or use very sparingly. And the skincare products question I have, we're going to get to skincare in just a moment. All right, exercise and pregnancy. Y'all keep the same energy when it's time to talk about exercise, okay? So it is just fine for you to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. That's not okay. You just won't feel like it in your first trimester. That's all right. In your second trimester, you'll have some physiologic changes that accommodate more activity. So please listen to your body. If you are not the Olympian athlete that you were 6 weeks ago, don't get too upset. It will come back and you'll be fine. It is okay for you to start a new regimen. It doesn't have to be anything crazy. It can just be some getting your heart rate up. We're going to talk about some good exercises to do in a moment. Please remember that a sedentary lifestyle, so sitting around not doing anything, leads to malpositioned babies, which is the most common reason we do C-sections around here. It's not big baby, it's not baby in distress, it is crooked head. So please get these heads straight, y'all, before we get into labor. Those of you with these cute little Fitbit watches that are giving y'all anxiety about your heart rates that you're monitoring all the time, please know that your resting heart rate is going to go up by 10 to 20 beats per minute as a normal physiologic change of pregnancy. That is fine. If you're not getting lightheaded or passing out from it, don't sweat it. For those of you who are saying, yes, I do exercise, Dr. Adams, I walk. And I said, well, we're going to talk about that. We're going to talk about it right now. So, walking can be considered exercise if you are walking with your heart rate in the aerobic zone. And the aerobic zone is 70% of your max heart rate. So your max heart rate is whatever your age is minus subtracted from 220. So let's say you're 30 years old. We start with the number 220, we subtract 30, and your max heart rate is 190. So when you are exercising, you should not be doing so at sustained heart rates above 190 for extended periods of time. 70% of that, though, is where your aerobic zone starts. So when you're walking, your heart rate is between 133 and 190 for 30 minutes, 3 times a week, then walking is exercise. If you are casually sauntering from your desk to the refrigerator at work and back to your desk, that's not exercise. That's transportation, but it's not exercise. So we're going to find some exercise for you to do. And on this next slide, we're going to tell you what exercises are just fine. All right. I'm going to hold off on these questions because I may answer some of them. Cardio, you can do treadmill, you can do elliptical, you can do running, you can swim. Swimming is awesome for pregnancy. So, I mean, y'all are super lucky that you're going to be pregnant through the summer months. Go for it. It makes your belly weightless. You can move your legs around. It's amazing. Indoor bike, Peloton is just fine. All the things like Robin Arzón did it through all of her pregnancies, although she's not really human, but whatever. If you like, go ahead, just do her classes. She's fine. If you have a Peloton, my leaderboard name is off my meds 8. We can follow each other and you can make me exercise more. If you were lifting weights prior to, you can continue to lift up to your pre-pregnancy level. You do not need to increase your resistance as your baby and your body will be doing that for you. If you are an experienced squatter, please continue to squat because squats are my favorite. If you are an inexperienced squatter, you want to start. And so 20 weeks, give me 5 squats a day. 21 weeks, give me 10 squats a day. You're building up to 50. They don't all have to be at the same time. In fact, it's nice if you spread them throughout the day to just keep those muscles lean and long and limber and all that good stuff. Pregnancy yoga and pregnancy Pilates are also some of my favorites. And if you have a good experienced instructor, they'll be able to tell you what the pregnancy modifications are. And it's typically things like not hanging upside down for long periods of time, that sort of thing, and not doing anything, really hot. So, for example, the things that you want to stay away from are on the next page. And it's the high intensity interval training after your first trimester. And it's not the intervals, it's the intensity. So you can do the low impact versions of these exercises, but you don't want to do anything that kind of gives you those sudden jerking movements that can shear your placenta. Anything that has you lying flat on your back for extended periods of time, like excessive ab work. So you can do side lying abs, you can do standing abs, that's fine. Hot yoga, unless you're a hot yoga instructor and are fully acclimated to that environment, otherwise you'll probably get dizzy. Scuba, because of the decrease in barometric pressure and decreased oxygen to the baby. High altitude hiking has come up a lot recently, so heights up to 8,000 feet above sea level are fine. for minimal exertion, but no hike. Like you can go visit your family in Colorado, just don't go hiking. Contact sports, please don't start kickboxing during this time. Also get questions about volleyball. So anything with like balls flying at your belly, just try to avoid that. Outdoor biking after 16 weeks has an asterisk because it's not a don't do it. It's a just keep in mind your center of gravity changes at about 16 weeks. So when you go to lean over to to turn a corner, you may lean a little bit and fall all the way over. So if you find that you're a bit wobbly after 16 weeks, then don't do that. All right, the questions that I have here. Should I stay away from inversions, doing exercise, i.e. aerial yoga, going upside down? I think I answered that one. So inversions after a certain point may turn your baby breech. So in third trimester, you definitely want to stay away from those. The next question, maximum up to how many steps can we take per day? Step all you want, my friend. And the next question is, I tried rowing class right before I got pregnant and loved it. Can I do that? Thinking about the physics of rowing, as long as you're not getting yourself into a position where you can hit your belly hard with anything. I don't think I've ever actually rowed. But that's the only danger is anything hitting your belly, but the actual motion of rowing is actually fine. All right, good. Y'all did have exercise questions too. That makes me happy. So now that we've talked about diet and exercise, can you prevent gestational diabetes with diet and exercise? And my veteran mamas who've done this webinar with me before know that the key word here is prevent. And the polls are closing in 4, 3, 2, 1. Done. All right, the answer is no. You cannot prevent gestational diabetes with diet and exercise. You can manage it with it, but you cannot prevent it. And let me tell you why we screen everybody for gestational diabetes. Because your number one risk factor is your placenta. You know how every other time in life you're like, this got to be my hormones causing this. Yes, this is your hormones. Like this is a time when I 100% agree with you. Your placenta is giving off hormones that tell your insulin not to do its job. And the job of insulin is to clear your system of glucose. And so when you become essentially insulin resistant, you have excess glucose circulating in your body, which is diabetes. But it's gestational diabetes because it's caused by the hormones in your placenta. So this is not a judgment on your lifestyle or anything like that. This is just saying this is how your body reacts to the hormones given off by your placenta. Now, if you can figure out how to do this without a placenta, then I do not need to screen you for gestational diabetes, but every single one of you has a placenta, and so off we go. Now, if the issue that, you're having is, well, I never ever, eat anything with any carbs in it, you eat fruit, you eat whole grains, so just continue on your normal regular diet prior to the test. Now, if it's the actual drink that bothers you, we do have a couple of different options. So remember that box that we clicked on really quickly, and I said this is a document that you'll need around 24 to 26 weeks. That is where we have our additional patient-driven options. We have here for sale in the office the Simply Pure drink, which is soy-free, it is dye-free, it is gluten-free, it is BVO-free, it's kosher, it's vegan, it's offensive to almost no one. But the other patient-driven options include the fresh test, glucoorganics, and some glucose tablets. And again, we have links to all of those things on our website, Full Circle Jacks. We don't do continuous glucose monitoring because we can't tell how your body responds to glucose after that. Because the bigger your placenta gets, the more hormones it gives off. Just continues to rage. All right, next. Preparing for birth. Some of you are going for unmedicated deliveries, and our recommendation is to prepare for that. Method classes are very important toward that. It's like running a marathon. You don't just wake up one day and say, I'm going to run 26 miles. You train for it. And so hypnobirthing, hypnobabies, Lamaze, Bradley method, these are all methods that are out there, and we recommend that you just start with these. These are for informational purposes only, but there are lots of instructors who give these classes to help you cope with what happens during labor. Even those who are not looking for unmedicated delivery, just maybe hoping to push the epidural off until, they're in truly active phase, these can help tremendously. I did hypnobirthing myself, and it was very helpful in getting my V back. The next question I have out here is, so glucose screening is done in the office? No, it is still done at the lab. But remember to read that document that I have on the website, because it states that if you are planning to if you're planning to do one of the alternatives, you need to let us know so we can write it on the order for the lab so that they are expecting, and we can't send you to Quest because Quest doesn't take outside glucose sources. Next thing is breastfeeding classes. La Leche League and the hospital have breastfeeding classes for new moms and for veteran mamas. Every new parent should know CPR. So here's a link to the Red Cross to learn infant CPR specifically, because it's not just doing adult CPR with one finger. It's different, the intervals and all the things you need to consider. Remember, I said if you are seeing a chiropractor, he or she needs to be Webster certified. That's a special pregnancy certification that deals with how your body changes during pregnancy to make sure that your adjustments are actually safe and beneficial toward getting your baby in a good position. When you come out of the bathrooms in the front of our office, there are a bunch of chiropractor cards out there. Those are all people who are Webster certified, and you can take your pick from any of those because, again, not endorsing any one or the other, just giving you some information. All right, next poll questions coming up. Next question I have from the audience is facing a lot of hair loss issues. Any suggestions for how to take care? And that is also something for your personal visit because usually it's the opposite during pregnancy, that hair. And if you're in first trimester, that may turn around in second trimester anyway. Usually hair gets thicker in second and third trimester. And then you have to worry about losing it again later on. Who's planning on working with a doula? So I see y'all have already started answering the question, so we'll close the polls in 4, 3, 2, 1. Awesome. All right, so this makes my heart happy that you all have some good doulas out there. Fantastic. So what is a doula? Some people were not sure. So doulas are there for emotional and physical support during labor because it's a lot before, during, and after pregnancy. So teaching you how to breathe through your surges, help you get into positions to help the baby to move down, help you to relax during labor as well. They are not medical, so they are not clinical. Like you are their clients, you are our patients, and they even say that they'll even say you are my client, you're their patient, and so they are not giving medical advice. They're not telling you whether you should take this certain medication or that certain treatment or that sort of thing, but they're helping you to cope with your feelings about our recommendations for your medical care. The best doulas that we've seen are the ones who, they come to your house when you're starting labor, or if it's, starting fast and furious, they meet you at the hospital when you're checking in, and they stay with you until that baby is latched. And so if you're looking for a doula and you're just not sure where to start, I think the most important thing is really, personality match. So talk to the midwives. They have no shortage of opinions of who their favorite doulas are who've been supporting our moms over the last 10 years or so. All right. So, acupuncture and pregnancy massage are both fine as well. Acupuncture is actually super helpful for people with a lot of nausea, for back pain, leg pain, all that sort of stuff. Even the person who asked me a little earlier about gas and gastrointestinal stuff, acupuncture can actually help you with digestion during pregnancy as well. Pregnancy massage is fine in all trimesters. Most places won't do it in your first trimester because that is when your highest risk of miscarriages, and they don't want to associate or you to associate two unrelated things. Some of them will still require a letter of clearance in second and third trimester. We do have a standard "it's okay to be massaged" letter for second and third trimester. So if you need one, then just let us know, and we're happy to email that to you to take with you to your massage appointment. Many of your insurances will cover breast pumps, so please scan our QR code around the time of your anatomy ultrasound. Is a good time to remember to do it. Please do not go rogue. Don't go off on your own looking for companies that will figure out how to get you a breast pump, because what we found is that people end up chasing that down for months and months, and eventually they'll get it, maybe before baby gets here. We found a company that's very efficient, that streamlines the process really nicely. Contacting your insurance company to find out which pump you can have. Contacts you, you pick your pump, they send us the prescription, and we just send it off for you. Most people get their pumps within about 4 weeks of starting the process. Same thing with the next question I have out here is about dental work during pregnancy. We do have a clearance letter for dental work as well. So please do not contact us the night before your appointment saying you need us to email you the letter. Please give us a couple of days 2 business days, in fact, to respond to any messages, but we are happy to email you our dental clearance letter or to fax it directly to your dentist. So if you write in requesting one of those, just if you include your dentist's fax number, that would actually be super helpful. We can send it right over to them. All right, for postpartum care for our moms who have any issues with blood pressure, as it does affect about 1 in 12 pregnancies, we will see you back in the office sooner than the usual for a blood pressure check because preeclampsia can happen postpartum, up to 14 days postpartum, in fact. If you have a belly birth, we'll see you back around 2 weeks for an incision check. Everybody gets routine mental health screens. Usually we don't do that for those who were identified as having risk factors prior to, we see it about 2 weeks after. Because baby blues are very common in the first 2 weeks, but if it's persisting beyond the first 14 days, then we want to make sure that everything is going okay. Postpartum doulas are a thing because remember, emotional and physical support. When do you need that more than when you bring home a brand new baby? And the motherhood space is another resource here in Jacksonville that we're very excited about. It's a collaboration with the YMCA downtown and Baptist hospitals, but open to anyone in the city with referral. And basically, it's just like a mother's, just a space for moms to meet with psychologists, to do some yoga, to have, and all of this covered by insurance with childcare for babies 6 weeks up to 12 years. You can bring your other kids too while you get some help if we've identified you as being at risk for postpartum anxiety and depression. It's really an amazing resource. And then pelvic floor therapy, which is the standard of care in Europe, and we're working on here in the United States, but really helps with those sensations of pelvic heaviness if you have any pelvic lacerations, difficulty going to the restroom afterward, or leaking urine afterward. Usually we'll start this at about 8 weeks. So after you come in for your 6-week postpartum visit, we refer you directly into the nurse who comes here 3 times a week and does pelvic floor therapy for 8 weeks. And you can bring your baby if you need to as well for those sessions. All right. I think, random frequently asked questions. Yes, you can sleep on your back. Yes, you can sleep on your left or your right side. If it freaks you out to sleep on your back, or if you are waking up feeling dizzy, get one of those wedge pillows off of Amazon. Just put it under one of your hips, and that will keep you rolled over to one side so you can't roll onto your back. You can help paint the nursery as long as the room is well ventilated and you're wearing your mask. You can take probiotics. You can dye your hair, including your eyebrows. You can do gel nails, but if you're going to be in a salon with really heavy fumes, it may help you to wear a mask in there as well. Summer vacation crew. Y'all can do car travel up to 37 weeks. After that, I don't recommend being that far away from us because you're full term. You can have your baby with strangers, and we don't want that. Just be sure you're getting out and stretching every 2 hours. In terms of skincare, you can use, I had this question earlier today, you can use your benzoyl peroxide, your salicylic acid, just nothing that has retinol in it. If you were using retinol before, there is a natural alternative. It's called bakuchiol, Bakuchiol, and that has all the good properties of the vitamin A stuff without the bad properties of retinol for the baby. Air travel, flying is just fine for my twin moms up to 32 weeks, for my singleton moms up to 36 weeks. Just please, please, please be sure that you are wearing your compression hose, you're drinking lots and lots of water when you're on that plane, which will mean you're getting up and going to the bathroom a lot, and you're doing toe raises in the seat to keep you from getting blood clots in your calves, as those can travel to your lungs and be very, very dangerous. Also, because you're my summer crew, no roller coasters and no water slides. My random frequently asked questions. And the question I have out here, do you recommend starting pelvic floor therapy during pregnancy? Only if you're having an issue. And if so, we have to refer you out for it because we don't do intrapartum or antepartum pelvic floor therapy. We only do postpartum here. All right, we're almost at the end here, guys. Thanks for rocking with me. All right, for COVID-19 update, for vaccinations, ACOG moved from supporting either way to strongly recommending it based on the 35,000 women who were studied and reported on in the New England Journal of Medicine. We do recommend Moderna and Pfizer, but not Johnson & Johnson because of its independent risk of blood clots and the pregnancy risk of blood clots added on top of that you want to avoid. So boosters are all vaccines are approved for boosters. If you're planning on getting a booster, or just trying to time it, third trimester is always a good time to do it because you will develop fresh antibodies, which you can use to give passive immunity to baby during breastfeeding. So if you're 6 months past any Moderna or Pfizer, you can get another one. If you're 2 months past a Johnson and Johnson, then don't get another Johnson and Johnson because blood clots. But you can get a Moderna or Pfizer because mixing and matching is okay. And there's no optimal time for these against your Tdap or your RSV or your flu vaccine because all of those work differently. If you do contract COVID, we don't have formal recommendations for ivermectin, azithromycin, or Plaquenil, so we don't prescribe those. But what we do recommend are vitamin C, vitamin D3, and zinc in the doses that you see listed here. We also recommend aspirin, 81 milligrams, little low dose aspirin until you're 36 weeks. If you get COVID after 36 weeks, please do not start the aspirin because you'll increase your risk for bleeding at delivery. At the time that you're diagnosed, if it's before your anatomy ultrasound, we start serial growth ultrasounds after your anatomy. If it's after anatomy, that's when we start looking because the aspirin and the growth ultrasounds have to do with the fact that we've seen more hypertensive disease in gestational hypertension in moms who get COVID during pregnancy, and we want to make sure that our blood vessels are still carrying the nutrients to the baby. So if you do contract COVID, we just recommend supportive treatment at home. We have cold medication recommendations on our website. You only really need to go to the hospital if you're having any difficulty breathing or a fever that's over 101 that you're just not able to break with normal amounts of Tylenol during pregnancy. For my moms who had their first baby or had a baby during COVID, take a nice deep breath because things are back to normal. We're back to 4 visitors in the rooms, plus your DONA certified doula. No one's wearing masks in the room or labor unless you actively have COVID when you are in labor, and then we ask that you not come in and breathe it all over everybody. Even if you do have COVID when you're laboring, we do not separate moms and babies. You're given N95 masks and an isolette to keep your baby out away from your respiratory droplets in the room. All right. So my last poll question is, what can you find on the website? Can you find information on safe medications in pregnancy? Can you find the birth plan template, what to expect at your visits? Or are you a rock star test taker and read all the way to the end and know that all of the above is the actual answer? And of course you do. 3, 2, 1, closed. Sweet. All right. Thank you guys. I know it was a rocky start getting on, but I do appreciate you staying on and rocking with us. Please remember we are social. So follow us on all the things. We have Twitter, which is now X. We have Facebook. We have, what's the other one? Instagram. I'm old, y'all. Anyway, please look out for on all of our socials coming up because I'm so excited. June 1st, Full Circle will be 10 years old. And so we have some fun celebrations coming up very soon. And I know, I'm so excited. I can't believe it. This is my most unruly baby. I have 3 children, and Full Circle is the one that like will not grow up. But in any case, um, you'll also see some amazing birth stories out there. We do have a series called In Her Words. So when you tell your awesome rock star birth story, please be sure to share it to inspire the next generations of moms who are going to come after you. I have someone whose hand is up. If you want to type something in the chat, I'm happy to answer a question unless you just didn't mean to raise your hand. And if so, you can lower it and then I will go ahead and sign off. But I don't want to sign off if someone actually has a question. All right. All right. I'm thinking maybe it's an accidental raise and maybe you were just trying to log off. So I'm going to go ahead and do that. Thanks again. And you guys have a fantastic evening. We'll see you in the office real soon. Bye.